Reed, can you just talk us through
I'm just
what we're doing
trying
right
to
now?
make it curved, so I'm thinning it as much as I can. Normally I'd have a hollowing out instrument, so I can hollow out this bit, which will weaken it, like the ear carving instrument. It will be similar to something like this, but much smaller and sharper. But it's fine. I think we can do it with the knife. It'll be okay. I'm also the root of the helix. I'm trying to make that not be too proud. I mean, I think we're getting there. Very close. Yep. Nearly there. Nearly very close. I think that's pretty good now. Do you agree? I mean, I can always thin it more once I've put it onto the base. We have the wires, do we?
Really, does it make a difference which side you actually thin it, the inner side or the outer side?
It does make a difference, but I think as a surgeon, it's very easy to adapt to that difference. I think there's advantages and disadvantages to both sides. So Bert Brent used to always use the contralateral, and I normally use ipsilateral, but I can see contralateral has advantages, the way the cartilage shapes. But with the ipsilateral, it's easier to drape, and then the perichondrium always sits underneath. So personally, I don't think it makes a big difference. Because even if you do the specific side, you don't know what sort of rib you're going to end up with. Let's just have a look at this. Can I have the wires, please? Needle holder. No. It's fine, don't worry. I was going to bend it, but it's fine. No, leave it, leave it. No, no, no. Scissors. This is just to support it, okay? So traditionally, we've always used wires. There is a slight shift to PDS at the moment. Let's let go a second. You want a little bit of root wire, please. That's fine.
Dr. Walid, can you talk us a bit through your fixation, your preferred fixation technique?
Straight 5/0 stainless steel wires. So they're coming out underneath, so we lift up the framework and we tie them. Okay? Yeah. Another wire, please. Let me just have a look at. So that's thick enough, I think. So this way of doing the rib makes it curve easier once you've thinned it. The other way gives you more height.
Can I just ask you, what's the width of the helix that we ended up with?
You mean this width?
Yeah, yeah.
I think I'd never ever measure it, but it has to visually look nice.
So
it's a helical rim.
Yeah.
Remember, you always got to think of the skin draping on top of that and adding more thickness. So you're always fighting a battle between too thin is not stable, too thick is not nice. Maybe 2 millimeters.
Okay.
I can always thin it once I've fixed it. I can always thin it from the inside, yeah? Let go a second. And there is a shift towards PDS at the moment in ear reconstruction, to use some PDS stitches instead of wires. Well, it's better that long term you don't have the risk of extrusion. But wires are easier. You can see they're double-ended, that you can just put them on. That's fine. Okay, wire again. So to me, when you combine the two heights, I think that's a pretty good height, yeah?
Another question, Dr. Walid. Do the fixation points, where you fix the helix to the base, does it actually matter, or does it make a difference?
I mean, here, the root has curved in naturally. Sometimes it's really trying to fight you. When you're just looking for stability, so obviously I want to use as less wires and stitches as possible, but as long as it's stable. See, the reason it doesn't look as high because we haven't hollowed out the scaphoid fossa. If we hollowed out the scaphoid fossa, actually that's quite high because the skin will, and I will try and hollow it out a bit more. Multi-tooth fossa. Actually, wire, please again. Actually, I'm just going to put this here. It's very thin. Yeah, I know. We'll see. I think that's nice. Yeah. I'm tempted to use the PDS a little bit. Yeah. Do you have some PDS? 5/0 PDS. The blue one, yeah? No, the blue one. No, no, it's fine. Did you not bring the round bodied, Ahmed? It's double-ended. Yeah, cut it in half for me. So this is a mattress stitch. It's a little bit thin, this rib here, but we haven't. Do you have another needle? She's a little bit. I've damaged the needle. So wires are very useful to fix it. Just cut half, please. Scissors to me. So this is how you tie the wires, just so I can show you. Artery clip, please. Oh, small. Scissors. 3 twists and a pull. 1, 2, 3, and pull. It's a very nice solid fixation. Okay, a millimeter. No, a bit more. That's it. Yeah. No, less. That's it. Gone. That's fine. You can always bend it here like that. So I think now we can just use PDS because this scissors to me. I've got good fixation. Yeah, it's good. Just take that. Scissors. Okay, PDS, please. It's fine, I've got it. Can I just swap that? Okay, PDS, please. This is temporary stitch, just to. Look. Let go, please, so I can see. Okay. So when I insert the framework, I usually take that stitch out, 'cause otherwise you'll see it. But I just wanted to get some stability. Another PDS, please. Just 1 second. Okay. What did I do there? Yeah. That's it. We can redo that, that's fine. Yeah, it's not right. Start again. fresh PDS, please. It's solid. I mean, the only issue with it is the height here. Let me just thin that a little. I think if we thin it,
Dr. Walid, are you thinning the helix right now?
yes, it's trying to give it more definition, because at the moment it doesn't quite have the definition that I would like. He actually has quite small ribs. I mean, we knew that from the beginning. He's on the absolute limit. What's important, this doesn't slide out, so we can have this support. Does that make sense? Force it. Another PDS, please. Yeah, I need to come back to this. Let's just put one here.
Dr. Walid, we have a question from the audience.
Yeah.
In your fixation of the helix, you used one stainless steel wire and the rest were PDS sutures. Is that
Yeah,
correct?
because I just feel the rib is very delicate, and the wires may cheese wire a little bit.
So there's no rule or there's no fixed number of wires or sutures?
No, I think Nagata used to use 60 wires in his framework.
And what do you prefer?
60 he used. I mean, there is no rule. When you think it's stable, you stop.
Yeah, so it depends from case to case or on the rib.
Yeah, I
each
mean,
case
I think
it's
every
very
like half a centimeter, I put a stitch.
And you try to limit the wires, is that correct?
No, I used to do it all wires. It's only in the last 2 years, all ear surgeons are gradually moving to PDS. We didn't used to think it was good enough for long-term stability, but now it has been shown. So I've moved to PDS.
But the wire that you used, you'll leave it, is that correct?
What happened to it?
You used one wire in the fixation. Will you be leaving it or will you be removing it?
Oh no, I'll leave it, because in the past it's nice and solid. I don't think we need to remove it.
Okay.
So I've actually never done a framework with just a knife. No. Never. Never. It's quite. get the definition. I think we've definitely got enough height. We definitely need to thin this down. But there's enough height in the framework. Okay, another PDS, please. Let's just put one there. The difficulty in this case, there is no soft tissue to utilize in the framework. So it's all, everything is about the framework.
Sorry, Dr. Walid, what do you mean that there's no soft tissue in the framework?
You know, there's no lobular component that normally comes up quite high. So you're relying on everything you're going to see through the skin will be the framework, yeah? Normally, there are other aspects that are incorporated that contribute to the air. But here you're relying fully on the framework, which is quite tricky when the ribs are quite thin as well.